This plastic surgery video is a liposuction to a man's flanks or love handles. This patient is asleep on the operating table and he's on his belly. What you see is me standing on his left side and the camera is actually where his head is. This cannula is not sucking fat out, it's actually putting fluid into the body, and it's putting fluid into the fatty tissue plane where I'm going to be performing the liposuction. I'm putting it in both the superficial and deep areas of the fat, and you can see from these markings that my hand is obscuring a little bit, kind of like a topographical map. The topographical map gives me an idea of what areas need to have the most fat taken out. And these drawings are made while the patient is standing. So the fluid is put in both the superficial and deep planes, and the fat is kind of blown up with this fluid to allow the fat to be removed easier with less bruising and less pain. The fluid actually has 2 medications in it. One controls bleeding, and one is an anesthetic. This will allow the patient to require less anesthesia while he's asleep and also allow him to be more comfortable for the first few hours after the surgery. What you see here is the liposuction cannula, and you can notice how it has a different tip structure. And this tip is designed to evacuate the fat. It is somewhat of an aggressive tip, and that is required when you are performing liposuction in the back area. The back area in particular can be very dense and very fibrous, so it is a relatively difficult area to get a nice contour improvement in, and it typically can be a little bloody because of the amount of fibrous tissue in the area. So my left hand is actually kind of feeling where the cannula is, and my right hand is doing all the work. It's actually my whole right arm that's going back and forth, and I can actually feel where I am in both the superficial and deep planes. So my left hand is kind of feeling what depth I'm at and if I'm at the right level that I want to be at. And throughout the procedure, I will constantly check the area with my left hand to make sure the area is being recontoured the way I want it to be, as well as I'm at the right depth. So we'll recontour this area in both superficial layers and the deeper layers in an effort to get the nicest improvement I can for this gentleman. I'm trying to show you here the color of the fat and how it comes out in the tube and the color it is, which is a nice golden fat color. Here you can certainly notice that there's a contour difference between the 2 sides, one which I have suctioned and one which I have not. And what I will try and do is match up those 2 topographical maps for the after concept. When I've completed one side, I will close the wound with a dissolvable suture, and that way the patient doesn't have to have any sutures removed after the wounds have healed. They will basically just dissolve. After I've done both sides, the patient will have foam placed on his lower back, and then he'll be placed into a garment. He'll wear the garment for about a total of 3 weeks. He'll wear it basically nonstop for the first 2 days, and then he'll take it off and take a shower, and then he'll get to take it off and put it on, wearing it for 11 hours on, and then 1 hour off, 11 hours on, 1 hour off, and he'll do that for about a week. Then I'll see him in the office and make a determination of, do I need to keep him in the garment longer using that technique, or can I allow him to only wear the garment during the day? Typically it works about 7 days around the clock, 7 days only during the day, and then 7 to 10 days only while they exercise. After that, they're basically out of the garments. So you'll see here I'm basically going to do the same thing I did on the other side, where I'll start superficial and deep, or deep to superficial, depending on where I am, and I'll work bottom to top in this case on this side. I am right-handed, so at some point I do switch different sides of the table to allow me a better angle of approach and for greater safety. You'll see here that my left hand does a lot of the feeling of where I am and helps me make sure I don't cause any injury in an area that I don't need to be in. Most importantly, you want to make sure that the cannula doesn't actually enter the abdominal cavity or the rib cage. So I'll use a pinch technique here with my left hand to kind of feel the fat to see if I'm getting it thin enough. And throughout procedures using liposuction, I'll do this very often to make sure that the fat layer is thinning appropriately. And I like it to be a nice uniform contour improvement. What you see here is both of the sides have been evacuated. And that canister demonstrates the amount of fat that was taken out from this man's back.